Hello, my dear pharmacists. This is Professor Komal. In this video, we'll see the mnemonics or easy trick for the angina pectoris or anti-anginal drugs, which comes under the cardiovascular disease and which is included in your drug inspector syllabus 2025. Okay, now we'll see the classification or easy trick for the anti-anginal drugs. Before going through the classification, first we discuss the what is the anti-anginal drugs and angina pectoris. The anti-anginal drugs, the drugs which is used to treat the angina pectoris or treat the chest pain by improving the blood flow. The angina pectoris, what is mean by angina pectoris? Angina pectoris are the which is the chest pain or discomfort from reduce the blood flow to the heart muscle. तर अंजाना पेक्टोरिस हे काय असतं, चेस्ट पेन होत असतं का, तर आपल्या हार्टला ब्लड फ्लो कमी झालेला असतो आणि हे कशामुळे होत असतं, बिकॉज ऑफ द करोनरी आर्टरी डिसीज. जी करोनरी आर्टरी आहे ते काय झालेले असते, कन्स्ट्रिक्ट झालेलं आहे, त्याच्यामुळे काय झालेलं आहे, हार्ट मसल्सला ब्लड फ्लो कमी होत असतो. सो देर इज चेस्ट पेन. सो चेस्ट पेन इज नोन ॲज द अंजाना पेक्टोरिस. आणि अंजाना पेक्टोरिसला ट्रीट करण्यासाठी जे ड्रग्स यूज करतो आपण त्याला काय म्हणतो, अँटी अंजायनल ड्रग्स. नाव विल सी द mnemonics for the anti-anginal drugs. First, there are main 5 class, okay, main 4 class, and last one is the other drugs. The first is the nitrates, second is the calcium channel blockers, then beta blockers, potassium channel openers, and other drugs. Main class is nitrate. The first class is the nitrate, which again classified into two types. First is the short acting and second is the long acting. The short acting example is glyceryl trinitrate, that is GTN, and second is the nitroglycerin. And for the long acting, the examples are isosorbide dinitrate, isosorbide mononitrate, and erythritol tetranitrate. The trick for the nitrate is 1 2 3 4 5 mono, okay, there is mono, di, tetra, like, okay. Then second class is the calcium channel blockers. The suffix for the calcium channel blockers are dipine, and the trick is LLB, fan, VD. VD for Virat and Dhoni. Okay, the first L for lercanidipine, then second L for lacidipine, then LLB, B for benidipine, fan F for phenolidipine, A for amlodipine, N for nitradipine or nifedipine, and VD for V for verapamil, and D for diltiazem. The next class is the beta blockers. For the beta blocker, trick is MAP. MAP means नकाशा आपण म्हणतो. तर फर्स्ट M for metoprolol, A for atenolol, P for propranolol. The next is the potassium channel blocker openers. The example is nicorandil, and last one is the other drugs. For the other drugs, the trick is don't try. For don't try, D for dipyridamole, O for oxyphedrine, N for nicorandil, T for trimethazidine, R for ranolazine, and I for ivabradine. Now we'll see the pharmacology of drugs. The first is the nitrate. First treatment for the angina pectoris is nitrate. The nitrates, the mechanism of action for the nitrate is nitrates which convert or nitrates which release the nitric oxide, and which helps nitric oxide which helps in the increasing the CGMP. Nitric oxide helps in the increasing the CGMP, cyclic GMP, and cyclic GMP चा रोल काय असतं, which helps in the smooth muscles relaxation. ओके, नायट्रेट्स काय करतात, नायट्रिक ऑक्साईडला रिलीज करतात, आणि नायट्रिक ऑक्साईड काय करतं, विच हेल्प्स इन द रिलीजिंग और इन्क्रीजिंग द सायक्लिक GMP, आणि सायक्लिक GMP हेल्प फॉर द स्मूथ मसल्स रिलॅक्सेशन. आणि आपल्याला इथे काय करायचं आहे, स्मूथ मसल्स रिलॅक्सेशन करायचे आहेत, किंवा त्याच्यामुळे काय होतं आहे, वेनोडायलेटर्स, आपल्याला वेन्स आहेत ते डायलेट करायचे, ज्याच्याकरून आपला ब्लड फ्लो आहे हार्टला तो व्यवस्थित होईल. ओके, द मेकॅनिझम ऑफ ॲक्शन, नायट्रेट्स विथ रिलीज द नायट्रिक ऑक्साईड nitric oxide which activates the guanylyl cyclase, GC, activates or stimulate guanylyl cyclase, and in the presence of guanylyl cyclase, GTP which uh, produce or which convert into the GMP. GTP means काय आहे तर guanylyl triphosphate which convert into the GMP in the presence of guanylyl cyclase. आणि GMP काय करतं the smooth muscles relaxation and there is venodilators. Okay, तर nitrates predominantly rather than the arterial dilation because of the enzyme required for the releasing nitric oxide from nitrates present mainly in the veins. Okay, nitrates are selectively venodilators, and high dose of the nitrates which cause the arterial dilation. The advantage of venodilation काय आहे तर advantage the which helps in the reduce the cardiac output as well as pulling of the blood and reduce the preload of the heart. Then side effect for the nitrates, the first acute chest pain, sorry the first incorrect first is the headache, then fatigue, nausea, vomiting, hypotension, and next is the methemoglobinemia. Methemoglobinemia means काय असतं तर blue skin किंवा lips due to the poor oxygen. Then high dose of the nitrates which cause the arterial dilation. Then route of administration, quick onset कोणाकडून भेटते तर इंट्रावेनस, सबलिंगुअल आणि बकल टॅबलेट, अँड स्लो ॲक्शन आहे ते पॅच टॉपिकल ऑइंटमेंट. देन कॉन्ट्राइंडिकेशन्स, phosphodiesterase inhibitors as well as the drug sildenafil the contraindicated आहे in the with the nitrate. Then pharmacologic action, low dose which shows the venodilation होणं महत्त्वाचं आहे कारण की ते काय करतं which helps or decrease the preload of heart, and high dose काय करतं arterial dilation करतं and also increase the coronary blood flow, vasodilation of both arterial and veins, relieve the hypertension. And last use acute chest pain म्हणजेच angina pectoris ट्रीट करण्यासाठी यूज केलं जातं. आणि सेकंड आहे acute coronary syndrome म्हणजेच काय सडन ब्लॉकेज ऑफ ब्लड फ्लो टू द हार्ट. दिस इज द pharmacology of the nitrates and mnemonics for the anginal drugs. Thank you.